Welcome back to the Jewish Policy Center webinar series. I am Shoshana Bryen, Senior Director of the JPC and your host. I hope you listened to the joint EMET JPC webinar last week. My conversation with Lori Regan and the truly outstanding Claire Lopez is posted on our website if you haven't heard it yet. We're back this week with Tevi Troy, public health expert and presidential historian. Believe me, they go together. We have two commercials, first for the JPC and second for two books you need to read. Even if some of you are returning to the office, you probably could use some additional reading material for the beach, right? It's almost vacation time. First, your JPC commercial. We were established in 1985 as a 501c3 organization, providing analysis of both foreign and domestic policies. You can find us on our website, jewishpolicycenter.org. You can read our insight articles, our magazine In Focus, our blog In Context, or you can read Alliance Tracker and Frontline Defense, blogs with a lot of good information about Israeli and American defense policy. We support a strong American defense capability and U.S.-Israel security cooperation and missile defense. We support the legitimacy and security of Israel against anyone who would deny them. As an organization that sits slightly to the right of center, the JPC advocates for small taxes, small government, low taxes, maybe small government, small taxes and low government, free trade, fiscal responsibility, and energy security, as well as free speech and intellectual diversity. In this series of calls, we've brought you scholars and policymakers on issues including China, Israel, Iran wreaking havoc across the Middle East and Persian Gulf, with a side trip to the Supreme Court, the defense budget, and America's long wars, and Turkey, and Azerbaijan, and the pandemic. As COVID-19 recedes in this country, we're going to take a look today at public health policy and how to restore the somewhat tattered reputation of America's public health institutions. But before that, your second commercial, as I introduce our speaker. The first book for your edification is Tevi Troy's Shall We Wake the President? 2 Centuries of Disaster Management, written before the pandemic. I wrote once that the title is actually a fraud because it's not really about presidents at the end of the day, and it's not really about disasters. It's about you and me and how we relate to crises. Tevi's conclusion was, individuals have a tough job. Although many Americans do know what to do in terms of crisis, millions more do not. If disaster strikes, we can now say when disaster strikes, we will all have to keep ourselves, our families, and our loved ones going without staff, without a massive bureaucracy, without an army, with just ourselves. It is resilience coupled with smart preparation that will get us there. I'm going to ask him how that relates to the pandemic. The second book you need is his current one called Fight House, Rivalries in the White House from Truman to Trump, which is about White House staff and its role in public policy. It should be noted that the idea of a professional White House staff was only generated in 1936 during the New Deal, which had many more programs, many more requirements. There was a committee, and the committee said, the president needs help. It suggested 6, just 6, executive assistants who would, quote, remain in the background, issue no orders, make no decisions, and emit no public statements. They would be, according to the committee, possessed of high competence and a degree of anonymity. Now, anyone who knows anything about government knows that when the idealistic picture met the reality of Washington egos, presidential and otherwise, it was doomed. So please read both books. They are historical, they are important, and they are timely. And please note also that Tevi had a piece in the Wall Street Journal yesterday about the history of leak hunting. So he's still on the presidential thing. Tevi Troy is founder and president of the American Health Policy Institute and previously served as a senior fellow at the Hudson Institute. As Deputy Secretary of Health and Human Services during the George W. Bush administration, he led the largest civilian department in the federal government, overseeing Medicare, Medicaid, food and drug safety, disease prevention, and other government programs. He also served as deputy assistant and then acting assistant to the president for domestic policy and as the White House Jewish liaison. He's a graduate of Cornell University and has an MA and Ph.D. in American civilization from the University of Texas at Austin. And most important from our point of view, Tevi Troy is a member of the Jewish Policy Center Board of Fellows. Now, remember to put your Q&A in the Q&A box on the screen. And we're going to do this a little bit differently today. I normally turn the floor over to the speaker, but I'm going to start with a question. Tevi, you said the United States wasn't ready for the pandemic, any pandemic. And that was not totally a knock on the Trump administration. You wrote, it goes back before that. Why were we in bad shape? How did we get in bad shape? What happened to us?
Thank you, Shoshana, for that question and for that very nice introduction. I would only add one word when you said I'm a member of the JPC Board of Fellows. I would say a proud member of the JPC Board of Fellows and a big fan of the JPC and all the good work that you do, and in Focus magazine, where I wrote this piece that has launched our conversation today. When I argued that we're not ready for the pandemic, I was specifically talking actually about coronavirus in 2016 when I wrote my book, Shall We Wake the President? I said that we have a strategic national stockpile that stockpiles all kinds of countermeasures, but it had nothing for coronavirus. I specifically said that in 2016. Now, I did not say SARS-CoV-2, because as far as we know, it didn't exist yet. But I did say that coronavirus is a different type of disease. It's a respiratory disease that presents a real challenge. We'd seen previous iterations of it with SARS and MERS, and it's a hard disease to get ready for. When I said we had no countermeasures, I meant we had no vaccine or vaccine platform. We didn't know how to make a vaccine for it yet. And we also didn't have any antivirals. So if a flu outbreak, we have antivirals that deal with flu. And we also know how to make a flu vaccine. Actually, the flu vaccine we make isn't even as effective as the coronavirus vaccine that we were able to generate within 9 months. But the fact of the matter is, when this thing started, March of 2020, February 2020, we were not ready. We did not have what we needed. And then we also found that we have multiple systems, including 3 layers of defense against this kind of disease outbreak, and all 3 of those layers failed us. So that's why I was saying we were not ready. And I'm happy to talk about the 3 layers. I'm happy to talk about what we can do to be ready in the future. But
explain the 3 layers. That would help us see the picture.
So when you think about disease management, you can't be ready for every disease at all times, because there's an infinite number of viruses or infections or what have you that you could potentially face. But you do have certain systems in place that can help give you the warning and prevent it from spreading. And then also, as I was saying, with the strategic national stockpile, provide the countermeasures that can mitigate the impact of the disease. So the number one thing that we do and should do, and the first layer of defense, is international monitoring. We have all kinds of people throughout the federal government who are supposed to be paying attention to what's going on around the world. If there's a new disease out there, they raise the alarm, they start talking about what we can do about it, how likely it is to come to the US, what the nature of its spread are, what countermeasures we have. And so preparation in advance for these kinds of diseases is really important. And what happened in this case is we relied too much on the word of the Chinese government. And I'm sure there are some people out there rolling their eyes saying, oh yeah, of course you know not to trust China. But the fact of the matter is, China got burned with SARS back in 2002, 2003. And they seemed to have mended their ways, and they had been more cooperative in subsequent disease outbreaks in terms of sharing information with the US and the World Health Organization. So there was a perception by our public health experts that, oh, maybe China recognizes that sharing information is a good thing, not just for them, but for the world, the US, et cetera. And in this case, the coronavirus outbreak was so bad, and as we're going to talk about later, they may have had some culpability in it, and they went back to their own ways. Now, you should never be surprised that a communist regime is not going to be truthful with its own people or the rest of the world, but that's what happened here. I think we were a little too trusting in what the Chinese government said, and therefore we're not really prepared. And then also, I feel like the World Health Organization is way too tainted by Chinese money and Chinese influence, and so they weren't able to do the hard look at what was going on with the disease. So we failed step 1 in terms of appropriate international monitoring of what was going on out there. The second type of defense we have is we generally are very good at testing and we can test people to see if they have the diseases, and then we can track and trace and isolate, meaning identify who has it, keep them away from others. If they did interact with others, find those people, isolate them as well. And this is one of the reasons why I was relatively unconcerned with respect to Ebola, because we knew how to test for Ebola, we knew how to track and trace and isolate people. And there was definitely some consternation back in 2014 about Ebola because it was so deadly, and because there are a couple of instances where our track, trace, isolate didn't work, and there were a couple of people, remember that doctor, I don't know if you recall, who kind of was navigating New York in a very millennial way. He went bowling and he got meatball takeout, and he went on the subway, and so he did all these things that increased the likelihood that the disease would spread. But we ended up finding that doctor, and we were able to, again, using good infection controls, help prevent the spread of Ebola. So generally we're good at that. In this particular case, I think the CDC was arrogant. They thought they were the only ones who could come up with a test. They and FDA were telling others not even to get tests developed. There was this one entity in Washington State that was working on a coronavirus test, and FDA said, stop what you're doing, which is not good. And the CDC kept saying, well, we can do the test. We know how to do the test. And there are other countries developing better tests. We could have adopted their tests. We could have had our private sector develop tests, which is eventually what we did with the vaccine. We had the private sector develop it, which is, to my mind, the best way to go about it. But we just kind of fell down on the job of testing. And if you can't test, then you can't trace it, and you can't trace, and you can't then isolate the people. And then it became too widespread to isolate everybody. So we ended up doing this massive quarantine. And then the third thing, I've already alluded to this, is we didn't have the proper countermeasures together for this in advance, even though people, including myself, had warned that we needed to get our act together on coronavirus. Basically, what happened when the disease was spreading out of control in the US in the spring of 2020, the only thing that our public health officials could tell the American people was stay in place and wash your hands. And that's not really a good way to help prevent the spread of a really deadly disease. So 3 layers of defense. They should work. They should work better than they did this case. In the future, I hope they do work better, and hope is not a strategy. So I'm going to continue to speak out on these issues and continue to try and make sure that we are ready for the future pandemic should they come.
So we fell into it, right? We weren't prepared. The fail safes, the things that should have helped us didn't work out as they should have. How are we doing at the end? I mean, the US at least seems to be in a place where people who want to be vaccinated certainly can get vaccinated now. There are people who don't want to be vaccinated. I'm going to go to that question in a minute. But people still do get COVID. So it leads to 2 questions. First is, how are we doing on developing treatments for COVID? This probably will have relevance in the rest of the world as well as the United States. There's a spike in Japan, and there's a terrible disaster in India. How are we doing on treatment? And what is the likelihood, in your view, that we could find a variant of COVID that could begin to evade the vaccines? So how do we finish up here as a nation, and how do we go forward with treatment and other things that are required?
Yeah, so we're at about 53% vaccinated. The US, I think, is in the top 10 of nations in terms of people vaccinations administered per 100 people, which is the way they measure this because there's more than one vaccine per person. The US was obviously at the forefront of developing the vaccine, which is not only a great thing, but really a modern medical miracle, and something that we should celebrate. And I think what we've learned through this unfortunate process is that NPIs, or so-called non-pharmaceutical interventions, were not going to solve this problem. This was not going away through just people staying in place and 15 days to stop the spread. That was not going to stop this. The only thing that was going to stop this was a vaccine. And we are fortunate that our great and innovative scientific minds in our private sector was able to develop this in conjunction with Operation Warp Speed, which was a government program that helped accelerate the development of a vaccine, and not just accelerate the development, but also accelerate the sometimes onerous testing schedule. So I'm very happy with that. You can't say it took too long, but the period in which we were in this coronavirus quarantine or lockdown, what was unfortunately too long. It seems like the US is getting out of it. Number of deaths are going down rapidly. As you said correctly, Shoshana, the people who want a vaccine pretty much are able to get it by this point. And it seems like through a combination of vaccinations and people who've previously had the disease, we are at this somewhat mythical level of herd immunity. The reason I say it's mythical is because nobody quite agrees on what the number is. But if you somewhere around 70%, if you have 70% of people are immune to a pathogen, it really reduces the ability of the pathogen to spread. And between vaccinations and the people who got it, I think we're in that territory. Dr. Fauci has unfortunately said that he's moved the goalposts on this. At one point he thought herd immunity was lower and then higher, or at least he said it was lower than higher. But the fact is, the number of deaths are down, the number of cases are down, and we seem in the U.S. to be getting out of it. I don't feel like I have to wear a mask when I go outside all the time. I'm going to be on the Washington Metro later, so I will be wearing a mask because that is the rule. And I really abhor the politics around the masks. If you're in a place where they say wear masks, I wear a mask. If you're in a place where you don't need to wear a mask, you shouldn't be mask shamed for not wearing a mask. So if I'm outdoors and not close to anybody, and also I'm double vaccinated, you shouldn't have some Karen yelling at you, hey, why aren't you wearing a mask? So I just don't like the politics of the masking. The masks are a tool that public health people use to try and limit the spread of a pathogen. They're not some kind of greater symbol of who stands where in a political divide. So overall, I'm relatively pleased with where we were, especially where we were as of a couple months ago. And the US is just in better shape. From what we see of this mRNA vaccine, which is really, again, a modern medical miracle, it seems unlikely that the variants are going to be a major problem, that there is resistance to variants from this vaccine. Now, it's important to recognize there are other vaccines out there that are less effective in general and less effective against the variants. But the Pfizer and Moderna, which are the mRNA vaccines, are remarkably safe, remarkably effective, and they do seem to provide protection against the variants as well. So I'm relatively optimistic, I would say.
And treatment options. I was going to ask you specifically, we're going to talk about censoring discussion later, but in the development of treatments, do you think that the blackout on the discussion of hydroxychloroquine damaged the effort to find treatments, the fact that certain doctors wanted to go ahead and use it and they were forbidden to use it, and that again becomes a political issue as much as anything else? How are we doing on treatment options?
Yeah, so I was definitely distressed by the politics around the treatment questions. And there's really two kinds of things we're talking about with treatment is how do you treat the patient when they come into the hospital? We were using ventilators pretty heavily in the early days, and those were not that effective. Also, we discovered there are certain simple things like putting people in the prone position are better ways of treating people. But then you also have the pharmaceutical interventions in terms of things like, we talked about remdesivir and hydroxychloroquine. I'm a big fan of letting the science decide on this and not letting the politics decide. It seems like there might have been more effectiveness to hydroxychloroquine than the public health community was willing to admit, and they were unwilling to admit it because they didn't like the fact that the president was touting it. That's just the worst way to go about with public health. That doesn't mean that hydroxychloroquine is a miracle cure either. So, I think both sides were overstating, and one was overstating its ineffectiveness. The other side was overstating its effectiveness. I don't think we have the ideal first-line antiviral that we want. We have some kind of I would say adequate antivirals, but not we don't have the right antiviral. I think those are, I think we're finding that those are in some ways harder to develop than the vaccine. We were able to come up with the vaccine pretty quickly. From the scientists who worked on it said it was a relatively simple molecule, so they were able to come up with an mRNA vaccine in an unprecedented amount of time. But coming up with an actual antiviral is hard, complex work, and there's a lot of testing that has to take place. So I'm not optimistic that we're going to solve the problem via antiviral in the near future. But our treatment options are better, and the vaccine is really the best way to go about to prevent people from getting it.
But this research on treatment options is still going on.
Still going on and going to continue to go on. Yeah.
Okay,
And in the
so
future, I would like to see the strategic national stockpile some of these antivirals if they are effective against coronaviruses in general, not just SARS-CoV-2.
is that one of those problems that you alluded to in your article in InFocus, the lack of stockpiling of things that we should have thought we might need? And so maybe this time we'll get it right.
Look, the stockpiling is a very hard, complex thing to do because if you have the right thing in the stockpile when the correct pathogen hits, then you're a genius. But if you've got the wrong thing, then you're an idiot and you wasted $500 million of government money every single year, which is what we spend to maintain the stockpile. That's why I'm in favor of trying to develop vaccine platforms. So something that's relatively adaptable to whatever the strain is. If you know how to come up with the vaccine for a general type of disease, and then you can adapt it to the specific strain, which is pretty much what we do with flu. I think that would be a good place to put our scientific heads and our scientific know-how. And then also the broadest possible antivirals that can work on multiple types. So you don't want an antiviral that's just for SARS-CoV-2, but that can work on coronaviruses in general if it can be developed.
Let's move to a slightly different area of the implementation policy, if you will. As is constitutionally appropriate, the states and governors were given the lead in dealing with their populations behind assistance and guidance from the federal government and the CDC. So there was some conflicting information, actually a lot of conflicting information coming from government experts in the beginning, which leads us to two questions. The first is, which states and local governments had the best record of dealing with this in terms of restrictions and lockdowns? And why were the presumed experts caught so flat-footed? You've said now a couple of times, it's complicated. We know it's complicated, but that's what they get paid for. The public health commissioner for New York, Osiris Barbot, told people to go to Chinatown for the Chinese New Year. Dr. Fauci told people COVID couldn't be widely spread by droplets and that people shouldn't wear masks, a position that he later recanted. And so start with those, because then I have another question about science and trusting science. So how did the states and governors do? Who are the standout governors?
So I think there's two elements to your question. First of all, I think there was the egregious behavior that you're talking about, Shoshana, in the early days where people were saying, how dare you say that there's a virus out there? I'm going to go to Chinatown and lick the poles or whatever. I mean, there's this sense that you can't even acknowledge that there may be a virus that's spreading that comes from a specific region of the world. And I really don't understand why you can't note that this virus comes from China. I mean, we talked about the Spanish flu. We talk about, the South African variant. I mean, this whole idea that you can talk about where a disease comes from unless it comes from China just strikes me as insane. It is not a political statement to say where the virus comes from. It is a geographic identifier that helps public health people figure out where the problem is emanating from. So I think that is a little nuts. But I also, I really have very low regard for those public officials who were telling people to go out and enjoy the revelry in Chinatown while this disease spreads. And I put a lot of culpability on those people. Then there's a second question. There's some overlap here with which states did better. And obviously there were some states that were stricter on the lockdown and some states that gave a little more flexibility. And I know the mainstream media likes to rip on Ron DeSantis and how terrible it is and Florida's a cesspool. But the truth is, Florida is a large, diverse state with an aging population, and or I don't say it's an aging population, but a lot of older people there, because a lot of the older people moved later in life, to the snowbirds and the like. And Florida did relatively well. I'm not saying they were the best state, but they were far from the worst state. And they also did not shut down their economy. And I think if you really look at the numbers, you're not going to find that red states were so much better on the death rates than blue states, or the blue states were so much better on the death rates than red states, but that blue states did more damage to their own economies, which also has health impacts, than the red states did. So they had kind of equivalent response success, with New York being, I think, a significant outlier and being a bit of a disaster, especially because of Cuomo's abhorrent policy on nursing homes, and then his denial that he told people that they must accept COVID positive people in nursing homes. But for the most part, the big difference was not in the number of deaths or the amount of people who got the disease, but in how much damage the states did to their own economies. And in that regard, the blue states were much worse off than the red states. And that's what I think is the takeaway.
That makes sense. We're probably going to have to learn more about how it played out when it's all over, if it's ever all over. But thank you for going past the kind of red state, blue state thing, because that's most of what we get in the media.
Right, and I just think it was unfair the way DeSantis was treated. There was just an assumption that because he was a Republican, that he was doing badly in his state. Because he was skeptical of lockdowns, there must be more deaths there, and it just wasn't true. And meanwhile, the covering up for Cuomo, which abated somewhat over time, but the covering up for Cuomo's disastrous performance, I think, was incredibly irresponsible.
So this is going to lead to another question about tamping down discussion. I don't want to say censoring, but in fact, there is some. So trust science was the sort of slogan of the COVID period. Everybody said, I trust science. I have neighbors who have signs out on their front lawns that say trust science. But it seems to me that science is a process, not a fact. And that the process of science sometimes takes a long time. Galileo was excommunicated for saying the earth revolved around the sun and not the other way around. People ridiculed Joseph Lister for saying that these invisible things called germs cause infection and that washing your hands would help. So if science is in fact evolutionary, it answers, by the way, some of the Fauci question. He was learning alongside the rest of us. He didn't say so. He announced that he had the science. He should have said he was learning. But it also makes the censorship of dissenting views really dangerous to public health. You've mentioned Chinese obfuscation, but we had our own obfuscation in the discussion of the possibility of the origins of COVID-19 in a lab in Wuhan. So I'm not going to ask you to give me your opinion on the lab theory itself, but tell us what happens to science and to public confidence in science when organizations like Facebook and Twitter and the New York Times, first of all, ridicule scientists with a different view, and secondly, censor the ability to have the discussion. What are we out here, the lay people, what are we left with when that happens?
Yeah, so Shoshana, this is a good question, but also a broader question. It's something that's been going on for a while. When scientific opinion seems to favor a point of view, then that side embraces the science. We see this especially on climate change. The Democrats say you've got to just trust the science, trust the science. Well, science should inform policy. Science does not dictate policy. And if science dictated policy, then why don't we just elect a scientist as president of the United States? I mean, the president has to consider a whole number of factors, including science, which again has to be accurate and fair and non-politicized. But you've got to include all that stuff as part of your calculation. With respect to Fauci, I mean, I hadn't heard that he was uncomfortable with the sense that he would dictate what the answers were. He is a scientist, and he says if you want to completely stop spread of virus, this is what you do. But there's all kinds of other factors, such as the economy and the Constitution and basic human freedoms. So you can't just say the science, the science, the science. You have to use science as a tool to inform policy. That's one. The second thing is you really want to be careful not to have science politicized. So if you say, well, the science decides, but there are certain things we can't talk about. Like, for example, your example of the lab leak is a perfect example. Over a year ago, Senator Cotton said we should look at this question. I think inappropriately so, and this whole sense that you couldn't even talk about it, which went on for a year, was just outrageous. But then recently, the worm may have turned, and you had the Jon Stewart clip that I know you and I talked about offline. If you haven't seen this, folks out there, you should watch this Jon Stewart clip. He goes on the Stephen Colbert show, and he starts talking about this possibility that it was cooked up in a lab, and specifically in the lab in Wuhan. And Colbert gets very uncomfortable and starts to question him on it. And Stewart says, look, when the name of the institute is the same as the name of the virus that is killing people, maybe that's a clue. And then he started going about, if the name on your business card says the name of the disease, that's also a clue. And so, I mean, he was quite funny on the issue. But the fact is, we don't know where this disease came from. We don't know if it was a lab leak. We don't know if it was a wet market or a pangolin or whatever. But we shouldn't be shaming or censoring people who are trying to ask good and useful questions. And I think the WHO initially they refused even to consider the question. Later, there was a study that the WHO put out where even they were somewhat questioning of China. They didn't say it was lab leak, but they said there's more questions to be asked. And so if even the WHO is questioning China, you know that there's something to be discussed here. So again, I think science is a useful tool, but we really want to be careful not to politicize it and not to have a situation where you really can't even have an honest discussion about it. Look, Galileo was excommunicated. I mean, there's cancel culture hundreds of years ago. So I think right now we have this situation where people try and excommunicate folks via Twitter or all types of cancellation. We shouldn't let it happen. We need to have honest and open discussion about these questions so we can get to the bottom and find out the answers and figure out how to do better next time.
I would point out, as someone smarter than I pointed out, that the Chinese have yet to produce a pangolin with the COVID-19 virus. So discussing pangolins and things may or may not get you where you want to be. But yeah, I think the Jon Stewart thing is important. And people look at popular culture and they say, why would Jon Stewart be important? He's important because he speaks to regular people and he's not the government. And so when you have a wildly left-wing person who was a huge critic of the prior administration coming out and saying something that people haven't been able to say for 12 months, I think it's important. Dissenters out front.
Yeah, not only the previous administration, but he was a critic of the previous administration, meaning the George W. Bush administration, for which I worked. I mean, he certainly has his left-wing credentials. But this is an important point. I'm going to go a little bit off topic here, Shoshana, but to talk a little bit about this whole idea of PC and cancel culture and wokeism and whether you can actually have honest discussions. And I wrote a long article for National Affairs recently. Maybe you can send it out to the list. I'll share it with you after this.
Give us the title. Give us the title.
I'll remember the title in a second, but it's about it's called I think the first PC war, and it was about what happened in the late 80s and early 90s when conservatives first pushed back against political correctness on campus, and I think successfully so. And there was really a 4-part strategy that I identified in the article. Because you heard a lot of the same nonsense then that you're hearing today. Then it was mostly segregated on college campuses, and now it's unfortunately spread out into the medical world and to the business world, and it's a broader and bigger problem today. But still, I think the 4 things that we engaged in as conservatives then to help push this back are worth discussing and worth keeping in mind. So number 1 is conservatives were pretty focused on highlighting the problem. They mostly put it in the context of free speech. They said we shouldn't. The American way is not to stifle free speech, and they pushed that point pretty hard. The second point is they worked really hard to broaden the conversation beyond just the sources that conservatives read. So they got it beyond National Review and commentary in the Wall Street Journal editorial page, but they got it more into the mainstream media. So we were having a broader conversation about it, not just a conversation among a bunch of hand-wringing conservatives. And then the third, which I just found astounding, you had voices on the left who were saying, we are not about this political correctness. We believe in free speech. So that was the third element. And then the fourth, and this is why Jon Stewart triggered it, is getting comedians involved to ridicule political correctness and its excesses and its ridiculousness. And you actually had a bunch of comedians making fun of it. I mean, Bill Maher, not necessarily my cup of tea, but he named a show Politically Incorrect because that was a pushback against the political correctness of the early 90s. There was a movie that Hollywood put out called PCU about politically correct university, about how an insane, out of control political correctness movement on campus. And there was just a sense that PC was not something you would be proud of. And there is a little bit of a sense now that woke was initially a compliment on the left, and now it's, I think, getting to be a bit of an insult in the wider culture. You say somebody's woke and you roll your eyes. And there are some comedians like Jerry Seinfeld who are saying they can't perform on college campuses because the kids are too uptight. And to the extent that you have people who are out there uh, who are willing to push back and criticize it, I think that's a good thing. And comedy is a great way to reach the broad swath of the American people, as you were saying. Lots of everyone, you and I know, Shoshana, reads commentary in National Review and the Wall Street Journal editorial page, but not everyone in broader America. But everyone in broader America hears it when a comedian is making these points, especially if it's a prominent comedian. And I think that's something that we can use.
It seems to me that having that kind of discussion and nothing being off limits actually increases people's confidence in the things that come out of government and come out of whether it's federal government or the state government or universities or whatever. If you have a sense that not all, that lots of different avenues have been discussed and tried and thought about, and this is what comes out of it, people respond with more confidence. And isn't part of public health the notion that people have to have confidence in what their government tells them to do? This is going to take us directly to the next question.
Great.
There are Americans who do not want to be vaccinated. Now, part of that is, I don't know what, but a serious part of that is a kind of lingering effect, I think, in the African-American community of very old secret US government trials of germs and diseases and treatments on African-Americans, many of which were fatal. Now, this is a long time in the past. This is not anything that's happening today. But there is what you call historical muscle memory. People think in the African-American community that maybe I don't want to do this. Maybe I'll watch everybody else do it for a while. What should we do to kind of help jump that? It's not just a question of vaccines not being available in the inner city. There is an issue to be addressed. There are other issues to be addressed with rural white people who also don't care much for government. How do we plan campaigns that go to the heart of those issues? You have to acknowledge those issues first, and people have to have confidence in you second, right?
Yeah, so with almost all of these, there's some kind of historical precedent. You rightly said the Tuskegee experiment has led to some skepticism in the African-American community. You had the Andrew Wakefield paper that suggested falsely and incorrectly, and this was debunked, but they suggested a link between the MMR vaccine and autism, and then also there's just this historic distrust of government. So you have different populations are skeptical of vaccines for different reasons. Then you also have some element of people who, for health reasons, can't get the vaccine. Then you have some people who are needle phobic. So I mean, it's not the majority of people, but you add it up together, and it makes it harder to get to herd immunity. And I really think you need two things. Number one is you've got to try and depoliticize the speech that comes out of the public health community. If public health is seen as leaning heavily on one side, and these surveys show that public health people are overwhelmingly Democratic, and only 4% of people in public health consider themselves conservative. That makes conservatives somewhat skeptical. So that's one thing. But the other is you have to get trusted spokespeople in those communities. I noticed a lot of tweets in the African-American community about the fact that both Hank Aaron and Marvelous Marvin Hagler died. Both of them had received the vaccine. I'm not at all suggesting that there's any relation between the vaccine and their deaths. In fact, Hank Aaron was, I believe, 86 years old. So it is not related, or at least, I've never seen any proven relationship. But when these two African-American sports heroes do die, and people in the community are saying, hey, maybe there's a problem here, you need some other trusted voices in that community to go out there and make the case, because it can't be me who does it, and it can't be Fauci who does it. It's got to be people who are trusted in that community. So I think both public health really needs to watch itself in terms of politicization, and you need to have trusted spokespeople in the relevant communities go out and give the message.
So what steps could the government take to depoliticize public health at this point? I think everybody's exhausted from listening to all different kinds of people on the pandemic, and we're hoping to have a summer where we just go to the beach and have a good time and read Tevi Troy's books. Is it an opportunity for the government to kind of resituate itself and start to build trust with the people, and how would they?
Yeah, I think you're right to say start to build trust, because it's going to be a multi-year, if not multi-decade process. I mean, there's a guy named Harold Pollack, who's a liberal political scientist at University of Chicago, very smart guy and someone I'm friendly with. He wrote a piece in the Washington Post that I cited in the article I wrote for you, Shoshana, that talked about the politicization of public health and the lack of trust that conservatives have in public health, because the public health people are putting their broader political messages inside their public health messages, and it breeds distrust. And he said conservatives are an important constituent, and if we want to get our messages out there, we need to make sure that we're speaking in a way that doesn't offend them and that they understand, and that doesn't seem to politicize the science. So it's kind of like what I was saying earlier with the with how to push back against wokeness. We on the right can highlight issues and we can try and get our thoughts into the mainstream media, but you kind of need the Harold Pollocks of the world to go out and do the work in their own community, which is the community of liberal public health experts, to try and get the reforms we need so that we can have public health messages that we can all trust. And in Shall We Wake the President, which you were very kind to tout and to review a few years ago, in that book, I talk about how the number one asset that the president has in terms of how to communicate to the American public is trust. If you have the trust of the American public and you tell them to shelter in place or to take a vaccine or give any instructions, then they are likely to do it. But if you lose the trust of the American people, if you're seen as not truthful, then you start to have real problems, and you can't get the American people to do what is needed when it is needed.
So all we need are trustworthy presidents and trustworthy public officials, and we're in good shape.
Right, but I mean, I think, look, that's and I want vanilla ice cream coming down from the sky all the time too. But I mean, I'm not trying to just wish for impossibilities. I think what we need to do on the right side of the aisle is work with the Harold Pollocks of the world, give them the ammunition they need so that they can better understand what makes conservatives uncomfortable, and they can do the reforming in their community. And, it's all great for Tevi Troy, who worked in a Republican administration, to say, hey, public health people, stop being political. I mean, but that doesn't work. You need more than that.
So a listener has written in, you mentioned that WHO is now kind of changing its position or shifting a little bit on the lab theory in Wuhan, and you indicated that that was possibly a bit of a surprise. The listener wants to know if you could talk a little bit about the relationship between WHO and China and why WHO might have towed the Chinese line in the beginning.
Look, China provides a lot of money to the WHO. They're more demanding in what they want from the WHO than the US. I mean, Donald Trump pulled out of the WHO briefly, but for the most part, the WHO is confident that the US will go along with what WHO wants, and they're less confident on the China front. China also gives a lot of money to a lot of smaller countries, including a lot of African countries with very close ties there, and it helps get it the votes it needs in terms of shaping the policy of the WHO. They're big backers of Dr. Tedros, who is the head of the WHO. And I'm not sure I said that they're changing their tune on the lab leak theory. I just think they said the minimum appropriate thing, which is maybe the Chinese haven't told us everything, or maybe there's more to see here, or maybe we need to learn a little more. But they did not, I wouldn't put them in the Jon Stewart category yet.
Not yet. Okay. We had a question from someone who points out that what the question is it possible to close down funding for problematic research such as gain of function, which was one of those things that was suspended in the United States at one point. But US funding went to China, where it was done in China. Can we actually close down research on things like deadly viruses? Possibly this relates to arms control as well as certain kinds of chemical weapons or other kinds of things. Can you stop research, or is the international community now at such a point where everything moves from every country to every country?
Yeah, it's really, I just love this gain of function thing, which is something that we in the kind of biodefense sphere knew, a term we all knew. But 2 months ago, nobody in America had ever heard it. Now everybody's kind of wielding it left and right. And I'm not talking about the questioner in particular, but it's become part of the wider conversation. Look, there are potential benefits to gain of function research. It's just you want them to be done in appropriate BSL controlled labs. I prefer that they be done in communist aggressor nations also, because who knows what they'll do with it. But I'm not opposed to any gain of function research done in again in an appropriate lab by a state that's not a bad actor. So often public policy overreacts to the problem in a minute. I would not want to go out there and say, let's ban gain of function research, but should we review our policy of who gets dollars for that, and what the restrictions at those labs are, and we get better answers about what those countries are doing with that type of research? Absolutely.
So we've come pretty much to the end of our conversation, and I thank you. People who listen often know that I like to end with a question, the answer to which is positive, so that we leave on a slightly positive note. And it's hard to think about doing that with COVID-19 and the number of deaths and the number of dislocations that it's caused over the last 15 months, but I'm going to try. Do you envision, so you've said a couple of things. First of all, we need to depoliticize public health. We need to review where money goes. We need to, I mean, there are all kinds of things that we need to do. How optimistic are you, particularly in today's polarized political environment, that we can do this stuff and look back a year from now or a year and a half from now and say, we're better off now than we were, both in the public health sense and in the political sense? If you don't have a positive answer,
you know, for reasons that I'm going to mention, that I have a positive answer, Shoshana, because Shoshana and I have a link that people on this call may be unaware of, which is we both worked for the great Ben Wattenberg, who was the ultimate optimist in public policy. And so I will always have a positive answer when there is one to be found. And I would actually commend to all the listeners my Washington Examiner piece, and maybe I could share with you, and then you could spread to the JPC community about reasons for optimism. But first of all, I'm incredibly optimistic about the ability to create this vaccine in only 9 months via Operation Warp Speed. I said this before, but it's a modern medical miracle, and it could be the foreshadowing of many additional great improvements in public health. I mean, there are other types of pathogens that could potentially be addressed via this type of mRNA vaccine. And I know when I was working in the Bush administration, we were talking about the potential transfer from egg-based vaccines to cell-based vaccines. And now we're leaps and bounds beyond this. This mRNA vaccine is potentially a game changer, and it's possible that in the future we look back at 2020, 2021 as a positive year for public health. Obviously, there were way too many dead. I believe 4 million around the world, 600,000 in the US, and it's terrible, terrible tragedy. But if this unleashes future medical miracles that really help save millions upon millions of human lives, I think we could look back and say, wow, this was a year where something good came out of it, in addition to all the horrors of the last year. So again, I would leave it to Ben Wattenberg to help inspire me always to find some optimism. And again, I celebrate our joint affiliation and joint connection to Ben.
Tevi Troy, thank you for an enlightening lunch hour. We will be posting this webinar on our website, and we will put up some of the links to things that Tevi has written more recently, so that you can just go click on his, excuse me, his Examiner piece or the Wall Street Journal piece. Thank you all for joining us. We hope to see you next week. And again, Tevi, thank you.
Thank you very much. Take care.